Hi, welcome back. This is Jen, your Medicare guide to your retirement needs. We're back today with a new formatted video, which I'm very excited to do. We're going to be searching the internet's most searched questions in terms of Medicare supplement or Medigap. So remember, if you like the information in this video, please make sure to share this to anyone who needs this additional information. Like and subscribe and comment down below what kind of questions you would like me to go over in the future. So let's get started. So here today, we're going to be focusing on Medigap Medicare supplement plans. So this is one of the options that is available to you for when you finally get your Medicare Part A and Part B. So the first question I'm answering today is, how do I know if I'm overpaying for my Medigap plan compared to other companies offering the same coverage? Which is a fantastic question, because here's the thing. So Medicare supplement is equal across the board. So every company has to follow the exact same coverage for Medigap plans, because that is regulated by CMS, the Centers of Medicare and Medicaid, okay? So Plan A, Plan G, Plan N, that's going to be the same going across all different companies. The main difference is, what are you going to be paying for? Because every company can set the price. And something to keep in mind is, as you age, that monthly premium for Medigap is going to increase as you age. So every birthday, they're going to send you an updated monthly premium for your Medigap. So it's important to keep in mind that every time you get those letters in the mail letting you know how much more you're going to end up paying for your Medigap, to just review if other companies are also going to be offering you the same rate. So that is one thing to really keep in mind, especially if you haven't shopped, for plans in the past couple of years. So the second question we're going to go over right now is, are there discounts for being part of a household, a non-smoker, or paying annually instead of monthly? So yes, so Medigap carriers really do offer household discounts. So if you live with another Medicare enrollee, if you both are on the same plan, some do offer discounts for non-smokers, and that is all part of the underwriting. Choosing auto pay versus annual payouts really does vary from company to company. So those are really good questions for when you are researching or asking, any advice out in the field. How do these companies vary on these types of Medigap plans? These are the little nuances that you really do want to ask these companies or research about these companies, just to make sure that you are getting the most value out of your Medigap plan, because these are pricey plans, and if you're aging and they increase with your age, you really want to make sure that you are getting the best value for a plan that is essentially offered for every single company. They are the exact same benefits, so make sure you get the most out of it. The third question we're going to go over today is, what's the best time to switch Medigap plans if you want to avoid underwriting and save money? So 2 periods, right? When you're turning 65, you avoid underwriting altogether. What is underwriting? Underwriting is that they do a medical history check on you. So they're going to go ahead and ask if you have pre-existing conditions, how often you go to the emergency department, within the past year. Have you had surgeries? Do you have a chronic condition? All of that is avoided the moment you turn 65. You have a period in which you need to sign up for Medicare supplement plans that they will not ask questions. They will not do medical underwriting. As a thank you, for you turning 65, and congratulations, they will offer it to you without question. The other time of the year that you should be able to go ahead and kind of reevaluate your plans is usually during annual enrollment period. That's the opportune time that you can make any changes to your Medicare supplement plan. And usually those are the times of year where most companies go ahead and let you know, what are the specials for that annual enrollment period. So remember, October 15th to December 7th is usually the time that, depending on the company that you have your Medicare supplement plan with, or you're interested in switching over into a Medicare supplement plan, see what each company has to offer, see what your current company is offering you in terms of trying to switch over into a Medicare supplement plan, if they will allow for you to switch over without having to do underwriting. So it just depends every single year. Remember, during annual enrollment period is usually the time that you should go ahead and ask those questions if there are any specials going on with Medicare supplement plans. So if a company is going to skip over underwriting, if you are signed up with a current company, what are the specials going on in terms of having that opportunity to switch into a Medicare supplement plan if you can avoid underwriting altogether. So it's really important to ask those types of questions, especially during annual enrollment period, so that you are getting the most information you possibly can in order to make the right decision for yourself. So the next question here is, how do you plan premiums typically increase over time? And what should I watch out for when choosing a company? So remember, it's not just age that you are competing against, right? It's also inflation. It's also company rate hikes. You're also looking for the history of the company as well. Do they have a history of offering lower rates? The strong financial stability of a insurance company as well, right? The same happens, with life insurance or annuity companies. You are looking at companies to make sure, does this company have a legacy? What is it that they offer me, or what can they offer me in order to receive the most value out of my plan? So those are kind of things that you kind of want to look into every time you are looking into a Medicare supplement plan. Are you, is legacy important to you? Is nationwide coverage important to you? Is what their offerings this year a little bit more competitive? And some companies do offer some Medicare supplement plans with a little bit extra bells and whistles in order to go ahead and win your business over. What are those bells and whistles? Are they worth the extra cost? Are they, most important to you at this time? So make sure, when you're going about choosing, a plan that has a high premium to it, that you're getting the most out of the plan. Or are you just going to be offered the exact same, Medicare supplement plan that every single company has to offer? The next question on here, are there high deductible Medigap plans that could save me money in the long run? Yes, that is Plan G. So Plan G high deductible plan offers you the same benefits as the Plan G plan. The main thing is that when you sign up for Plan G, you want to look at what is this particular Plan G offering me. Some companies have been adding extra bells and whistles, as I said before, to their Plan G offerings just so that they can set themselves apart. And again, it is up to you how you want to handle that information. If you do not have vision coverage, if you don't have hearing aids and you need hearing aids, some of those Plan G options are going to start adding a little bit of those extra perks in order for you to go ahead and choose that company over others. And so when those companies are now adding those additional offerings, you need to outweigh the cost of it versus, how healthy of an individual am I? Do I really need a Plan G option? Can I get away with a dental vision hearing plan? So those are different kinds of decisions that you need to make for yourself in order to realize where, if saving money is the most important thing to you, where can you save money? What benefits are you really going to utilize for the year? Those are things that you need to ask yourself. The last question I have on here is, if I'm healthy, should I consider switching to a lower cost Medigap plan, even if it means going through medical underwriting? I wanted to save this question last, mainly because this is the biggest question that I get asked by seniors as they're aging. Remember, as you age, the monthly premium for a Medicare supplement plan will increase as you age. And some of those prices are becoming astronomical, especially this year. Whenever you're watching this in 2025 is the first year of the Inflation Reduction Act implemented into Medicare. So there were a lot of changes happening. Inflation is going up as well. So a lot of seniors are wondering, is my Medigap plan worth keeping anymore? Should I downgrade? Should I upgrade? And here's the thing. If you are in relatively good health, I would say it would behoove you to see what other plans you can qualify for, because you need to remember you are going to go through medical underwriting. The thing is, as you age, you are going to be using your health care more often than not. You are the only person that could determine, am I going to use skilled nursing in the future? Am I going to go and, get surgeries in the future? Do I feel like, am I taking a crazy amount of medications? These are certain things that you have to kind of evaluate for yourself. And the most important thing is during AEP, that is the time to reevaluate. And if you already have a Medicare supplement plan with a particular company, again, it would behoove you to reach out to that company and see, what can I do to avoid underwriting if I want to reduce the benefits of my Medicare supplement plan, but still keep a Medicare supplement plan and just lower the cost of it? And vice versa, if you want to increase the benefits of your Medicare supplement plan, are you able to upgrade, and can I just be rolled over into a better plan without medical underwriting? So those are the ways to go about and the questions that you should think about and ask when dealing with Medicare supplement. Other than that, those were the internet most searched questions for Medicare supplement plans. If you found this information useful, please feel free to share this video, like and subscribe. Comment down below as to what further questions or which part of healthcare you would like me to cover and answer the most searched questions, and I'll be sure to put out that content and information in the future. I'm Jen, your Medicare and retirement guide. My information, if you would like me to go over your plan options, description down below, click that link. I would be more than happy to help you and see what plans are available in your area. Other than that, I hope you have yourself an excellent day, and I'll see you in the next one. Bye-bye.